More than 2 years into the pandemic, President Biden has tested positive for COVID-19. Thanks so much for joining us. I'm Angela Taylor.
And I'm Russ Bowen. The president's doctor says his symptoms are mild and include a runny nose, fatigue, and occasional dry cough as well. He's being treated with the antiviral drug Paxlovid. President Biden, who is 79, is vaccinated and has been boosted twice.
I anticipate that he will respond favorably, as most maximally protected patients do. Early use of Paxlovid in this case provides additional protection against severe disease.
I'm doing well. I'm getting a lot of work done. I'm going to continue to get it done. And in the meantime, thanks for your concern and keep the faith. It's going to be okay.
The president recently returned from the Middle East and was in Massachusetts on Wednesday, where he came into contact with several members of Congress. The White House says he will continue to carry out all of his duties in isolation until he tests negative.
Now, medical experts believe that President Biden has a good chance of fighting COVID.
Two leading experts from our area and in the field explain just why that is. President Biden's positive COVID diagnosis comes with mild symptoms like fatigue and a runny nose. That's what many can expect if they are vaccinated and boosted when infected with the latest variants, BA4 and BA5. They are much more contagious but less dangerous.
If you're fully boosted, you have good protection against hospitalizations and deaths. But even then, the protection against infection is good, but not perfect.
Dr. David Weber with UNC Health and Dr. Cameron Wolf with Duke Health agree the fact the president has been vaccinated and boosted twice is vital in keeping him from being critically ill.
So if you're someone who's in their 70s or 80s and you've been appropriately boosted, you may still get BA5 as a breakthrough. We're seeing that probably more than previous variants. But your risk of getting it severely enough that you land in hospital, like we were seeing a lot of last year, that's still way down.
Biden's prior health assessments have shown him to be in good health, but at 79 years old, he's still considered high risk. Weber and Wolf say the decision to treat the president with the antiviral Paxlovid is the right one.
The earlier you give the antiviral, the better and more effective it is. So we don't wait these days for people for those drugs I mentioned to become seriously ill. If people are at high risk for serious disease by virtue of being older, like President Biden, or having a weakened immune system, as soon as they were diagnosed with a positive test, we would begin the drugs.
I think no one would argue in someone who's in their late 70s and therefore high risk of COVID progression relative to someone who's younger. This is a very safe choice. It's reasonable that he's getting it early on.
And Angela, you know, we also talked about the comparison between now and when President Trump was diagnosed, right? How far we've come. When President Trump was diagnosed, he was hospitalized. He underwent experimental therapy, which, by the way, now has been approved by the FDA as a therapy.
Right.
We have so many more tools in the toolbox.
Yeah, we've come a long way since the first diagnosis.
That's right.